Hey everybody, Dr. Dan here. Let's have a conversation about low iron or anemia. First of all, low iron or anemia is never okay. It's always an issue, and that's not a platitude. Iron is a metabolic necessity. You need it in order for your liver to be able to transform toxins, metabolic waste, and hormones. So it causes issues with all kinds of different conditions. So chronic fatigue, fibromyalgia, autoimmunity, infertility, low thyroid, all of these things are impacted by low iron. Matter of fact, every disease process, any illness, any condition is going to be worsened by, if not contributed to, by having low iron. You see, in the last phase of energy production in your mitochondria are what? It's the powerhouse of the cells. That's right. So in the last phase, in order to maximize energy output from your mitochondria, you have to have iron. So it is so important. So what do? If you think you have an issue, and one of the things that we've seen is people who have been told they have low iron or anemia most of their life, they just accept it as commonplace, and that's not okay. It still needs to be addressed. So what do? Well, there's 3 questions you have to ask. Is the iron low due to intake, absorption, or loss? So when we're talking about intake, are you consuming enough? So people who don't get enough red meat or eat red meat, maybe you're vegan, vegetarian, or just don't like red meat, that may be an issue. So your iron needs to be looked at, and you need to look at ferritin. You need iron and ferritin and something called total iron binding capacity. That'll give you a good picture of, is your body getting enough iron? The second thing is absorption. So if you have gas, bloating, constipation, diarrhea, or acid reflux, you may not be absorbing iron appropriately. You have to have really good stomach acid, and you have to have maximum absorbability of your digestive tract. The last is loss. Maybe you're losing it. So women who have heavy cycles, maybe you have blood in your stool, you can lose almost a teaspoon of blood a day and not actually see it in your stool. So you need to get some stool testing. It could be in your urine, or if you've had any massive injuries or trauma recently or surgery, you could add some blood loss there. But you always want to identify where it's coming from. And by doing that, you can figure out how to fix it. Hope that helps. Have a great day.